Lecture.5 Ophidia. Lachesis continued.
Lachesis causes in the male an increased lasciviousness with the diminution of the physical power. The mind is a prey to all sorts of allurement, but erections and emissions are imperfect. Upon the female organs, Lachesis acts very powerfully. It seems to have a special affinity for the ovaries, particularly the left ovary, ovaritis, overalgia and tumor may be relieved when there are tenderness to pressure of the clothing and other characteristic symptoms of tetanus. Menses scanty, feeble, blood lumpy, black and very offensive, pains in the hips, bearing down in the region of the left ovary, all better when the flow is established. The uterus is also intolerant of least pressure. Lachesis may be used in puerperal metritis, especially when the lochial discharge is fetid. The face is purple and the patient unconscious. It is indicated in ovarian tumor when the disease shows a tendency to extend from left to right, even when suppuration has taken place. It is especially called for after hepar or Lachesis when there is great edemia. రెస్పాన్స్ లేకుండా అసలు ఏంటో అది చేంజ్ చేయనప్పుడు తర్వాత ఇది ఇస్తే బాగా పనిచేస్తుంది. In syphilis, Lachesis is called for as an antidote to mercury or when the chancre becomes gangrenous. Its characteristics are found in its peculiar sore throat, the blue surroundings of the ulcers, nicky bone pains, violent headache and the phasodemic chancre. The syphilitic ulcers on the legs are flat and have blue surroundings. Caries of the tibia, the parts are sensitive and livid. Ulcers in the throat, bone pains at night, all after abuse of mercury. The bluish ulcers allied with hepar, asafoetida, lycopodium, silicea and arsenic. The pimples, blisters or pustules surrounding the ulcers allied with arsenic, phosphorus, lycopodium, mercurius, hepar, silicea, etc. The burning in the areola with arsenic, lycopodium, mercurius and silicea. The offensive pus with arsenic, asafoetida, lycopodium, silicea, sulfur and hepar. The ulcers being flat with arsenic, asafoetida, lycopodium, mercurius, silicea, phosphoric acid, etc. If they become black or gangrenous with arsenic, sepulchre, silicea, plumbum, carbonate, euphorbium and uric acid. But Lachesis has the burning most marked when the ulcer is affected. The surrounding skin is mottled. Ulcers on the legs tend to spread superficially rather than deeply, as for example in calipi. The discharge is scanty and the strength is failing. Dark blisters encircle the ulcers and the surrounding skin is dead. Sometimes the discharge ceases, the patient is stupid, cold, the leg becomes edematous and a bluish swelling along the course of the veins shows that phlebitis exists. All this looks like arsenic, carbonate, bufo, secal, cinchona, etc. But arsenic presents more vascular excitement and nervous irritability with the prostration. Carbonate induces still greater prostration than Lachesis, cold sweat, cool breath and collapse. The ulcer has a cadaveric odor. In mild cases, there is no resemblance at all between the two. For carbonate causes much burning, rawness in the folds of the skin, bottoms of the ulcer hard but not oversensitive as in Lachesis. Hepar should be remembered as a concordant of Lachesis, especially because it is so useful after abuse of mercurial. The areola of the ulcer is very sensitive, but there is a sore, bruised feeling together with hyperesthesia. And although the suppurating part turns bluish and the patient experiences weakness, yet there are no evidences of loss of vitality and gangrene such as suggest the latter indicated drug Lachesis. Lycopodium is here again a complement of the snake poison. In syphilitic ulcers, if syphilitic ulcers appear in the throat, they are dark greyish yellow, worse on the right side. The forehead exhibits a coppery eruption and the face is shallow, often furrowed, but lacks these small red blood vessels which shine through the yellow skin in Lachesis. Chancres are indolent. Condylomata are pedunculated. Ulcers on the leg refuse to heal with tearing, burning worse at night. They are made worse by poultices and by an attempt to dress them. The pus is often golden yellow. There is flatulent dyspepsia. Nitric acid should it seem similar in grasdenic chancre, ulcers on the tibia, etc., may easily be distinguished by the irregular edges of the ulcer, which also presents exuberant, easily bleeding granulations, and its mouth and throat symptoms may be differentiated by the cracks of the commissures of the lips, sensations of a splinter in the throat, etc. Caliiodate exhibits a very different train of symptoms from Lachesis. Gnawing, boring bone pains, throbbing and burning in the nasal and frontal bones, greenish yellow excoriating ozena, papules ulcerating and leaving scars, rupia, chancres with hard edges and curly pus, ulcers deep eating, violent headache, much more severe than in the snake poison, and cause hard lumps on forehead, on the head. Tendency to intestinal infiltration of soft tissues, interstitial infiltration of soft tissues and also of bones, thus more extended than with Lachesis, which infiltrates only the soft tissues. In the uterine and ovarian symptoms of Lachesis, your attention is directed to the following comparison. Platina has profuse dark lenses instead of scanty flow, and the hardier is much more pronounced. The nymphomania is accompanied by trilliation and tingling of the genitals with more vaginismus. In ovarian affections, this drug has relieved after Lachesis failed, as in suppuration of the ovary, and the pus having been evacuated after the action of the latter. Under the action of the latter, the pains are burning with violent bearing down. Palladium has relieved induration and swelling of the right ovary, as has Lachesis. Lachesis తోటి తర్వాత మ్యూరెక్స్ తోటి ఇవన్నీ లెఫ్ట్ సైడెడ్. సేమ్ ప్లాటినా లాగా మ్యూరెక్స్ లో కూడా నింఫోమేనియా చాలా ఎక్కువ. కాబట్టి ప్లాటినా తాలూకు ఓవర్ కాన్ఫిడెన్స్, ఆ రకాలైనటువంటి హై హ్యాండెడ్నెస్ అవన్నీ మ్యూరెక్స్ లో ఉండవు. అలాగా మిగతాన్ని సెపియాలా ఉంటాయి, మెంటల్స్ అన్ని సెపియాలా ఉంటాయి, నింఫోమేనియా ఉంటుంది. సెపియాలా అది ఉండదు, సరిగ్గా ఆపోజిట్ ఉంటుంది. లెఫ్ట్ సైడ్ ఓవేరియన్ ట్యూమర్స్ అన్ని కూడా వీటిలోకి వస్తాయి. రైట్ సైడ్ ఇవన్నీ మళ్ళీ లైకోపోడియము, కెలాడియము, తర్వాత కెలాడియంలో కూడా కెలాడియంకి మ్యూరిక్కి అదే తేడా. రెండింటికి నింఫోమేనియా ఉంటుంది, కానీ రైట్ సైడ్ ట్యూమర్స్ లో కెలాడియం ఇండికేట్ అవుతుంది, లెఫ్ట్ సైడ్ దాంట్లో మ్యూరిక్స్ ఇండికేట్ అవుతుంది. Palladium has relieved induration and swelling of right ovary, as has Lachesis. Mentally, the two are widely different. The former develops an egotism which manifests itself with the patient's concern for the good opinion of others. Consequently, her pride is often injured. Mental emotions aggravate the ovarian pains as in the snake poison, but in a different way. The Lachesis patient is ecstatic or at least excitable. The relating of stories moves her to tears. The Palladium patient is easily agitated in society. A lively conversation or some evening entertainment increases her pains and tries her mentally and bodily. In ovarian affection, epis stands closely allied to Lachesis, but it acts more on the right ovary than on the left. There is a bruised sore feeling or a stinging burning. At other times, the pains are described as lancinating. In prolapsus uteri or during the menses, the bearing down seems to be in the right ovary, pains followed by a scanty dark mucus. Both have pains from the left to the right ovary, but in epis these are experienced while stretching. There is also a strange feeling in the ovarian region, very characteristic. The pains may ascend in either, but in epis they are in the right ovary, with the pain also in the left pectoral region and cough. Mentally there is considerable similarity. Both have jealousy with talkativeness and increased sexual desire, restlessness with bustling manner. Bustling manner. Bustling is B-U-S-T-L-I-N-G. Huh? Maybe ఇక్కడ అర్థం Bustling, B-U-S-T-L-I-N-G. Medical term कर दिया. Fast का Arsenic affects the ovaries and uterus and has meteorrhagia of dark blood and increased sexual desire. But this powerful agent affects more the right ovary with marked burning, tensive pains and restlessness, which is somewhat relieved by constantly moving the feet. Menstrual colic better from warm application. Lycopodium reverses the Lachesis direction of pains, shooting from right to left. Its gastroenteric symptoms are also always present. Although graphitis more often affects the left ovary, it will also relieve when pains in the right ovarian region are followed by a discharge from the vagina. But constitutionally, this drug and Lachesis differ. A marked symptom of Lachesis is the relief of pain when the blood follows. Compare moisture, drying, pulling at the beginning of menses, ceasing with the menstrual flow. Income, relief of bowing in the left ovary, just like Lachesis. Latina and ammonium carb have pains which continue with the flow. The former even with a profuse discharge, the latter with flow between pains. In Actia racemosa, the more profuse the flow is, the greater is the pain. This is opposite model. Now the heart, circulation and fever. Lachesis, as I have already intimated, affects the circulation markedly. It causes a flushing of heat as at the climaxes, rush of blood headward with coldness of the feet, palpitation of the heart, with a feeling of constriction about the heart as if tightly held by cords. These latter symptoms with the oppression of the chest, the dyspnea on awaking and the inability to lie down have led to the use of Lachesis in hydrothorax and hydropericardium when dependent on organic disease of the heart. Lachesis is indicated in general dropsy when the urine is dark, almost blackish, and contains albumin, and the skin over the edematous part is dark bluish black. I remember a man 60 years of age who had just sort of a dropsy and continued to live for 6 months under the action of Lachesis, and whose death when it came was painless. It is especially useful in the ascites following scarlet and the ascites of the drunkards when the above symptoms are present. In renal and vesical affections, Lachesis is to be selected more by the general than by the local symptoms. For instance, in albuminuria or morbus brightei, the respiratory symptoms, aggravation after sleep, and blue surface are most characteristic than the urinary symptoms. In cystitis, the drug is indicated when the offensive mucus introduces the universal characteristic of tendency to putrescence. And the more this offensiveness of the urine is disproportionately intense when compared with the time of the vesical retention of the mucus, the more likely is Lachesis to be the remedy. In hematuria, the drug, like its powerful rival Crotalus, is called for when the symptoms occur as an evidence of blood degeneration as in low fever. So hence there is the characteristic deposit of disintegrated blood cells, fibrin, etc., presenting the appearance of a charred straw. In albuminuria, after scarlet, there is a dropsy and delayed disclamation, and the urine is black or contains black spots. ఇక్కడ Crotalus కి Lachesis కి తేడా ఏంటంటే Crotalus బ్రైట్ రెడ్ బ్లడ్, Lachesis డార్క్ అండ్ బ్లాక్ బ్లడ్. అక్కడ అది కూడా తేడా వస్తుంది. This spotted appearance is precisely like hellebore. Other remedies causing black urine are colchicum, natramor, carbolic acid, and digital. Epis, ammonium bench, arsenicum, benzoic acid, arnica, opium, carbovage, calicarb, and terebinthina produce dark turbid urine. Lachesis alone, however, has the foaming urine and the general characteristics already discussed. Helleborus is to be distinguished by the sensorial apathy, muscular weakness, pale puffed face, and jelly-like mucus diarrhea, which accompany its dropsy. The patient may breathe better than lying down, which is the converse of Lachesis and arsenicum. Digitalis, with blackish, scanty, turbid urine, faintness from weak heart, with bluish face, looks very much like Lachesis here. In the latter, there is more laryngeal constriction as well as the oppression and constriction of the chest. In the former, the suffocative constriction is as if the internal parts of the chest had grown together. Digitalis has also a sinking or faintness at the stomach, as if life was becoming extinct. Terebinthina has a smoky and turbid urine depositing a sediment like coffee grounds. It is often indicated in dropsy after scarlet. The sediment contains disintegrated blood corpuscles, hematuria, dyspnea. The patient must be propped up in bed. There is great drowsiness. The tongue is dry and glassy. Clinically, terebinthina has proved useful in the early stages of renal disease when condition predominates, that is, before renal casts appear in any great quantity. It causes more intense burning and pain in the back than Lachesis, and the urine may have a violent odor. In typhoid fever, both renal and alveolar discharges resemble those of Lachesis. Fetid stools, hemorrhage from the bowels caused by ulceration. The blood is dark, sooty, and looks like a coffee ground. Fetid urine, disintegrated blood in the urine. In addition, terebinthina causes stupor, dry, smooth, glossy tongue, and great weakness. But it is distinguished by a preponderance of tymphanitis with burning, which is accompanied by a smooth tongue as if it has lost its papillae. Epis simulates Lachesis in post-scarlet dropsy. For both remedies have albuminuria, scanty urine, which is dark from decomposed blood and dyspnea. But Epis usually requires surplusness, pale, waxen skin, and an eruption here and there resembling little rash, red pimples, or an erysipelas rosy appearance of the anasarcus limbs. Arsenicum is needed in cases of renal disease when the urine is scanty and albuminous without blood, the remedy being required on account of its well-defined heart symptoms or its mental restlessness, etc. Thus far, it needs no differentiation here. But if the urine is dark, turbid, blood mixed, depositing a coffee-like sediment, it is if there is orthopnea with cold legs, bronchial catarrh, great difficulty in breathing until phlegm is raised, spasmodic constriction of the larynx, the choice may demand further comparison. Arsenic cures when the urine looks like dark dung water and renal casts are abundant. The dyspnea is noticed more when the patient attempts to lie down in the evenings, and again it rouses him after 12 p.m. It is relieved by the expectoration of mucus. In Lachesis, the dyspnea is worsened when after lying he drops off to sleep. Relief follows the hawking of loose mucus or coughing up of a small amount of thick adherent mucus, and there is far more annoyance from the contact of the clothing than there is with arsenicum. In the latter, the clothing is torn to loose lest its pressure smother the patient. In the former, there is added a cutaneous hypertension. Colchicum causes an intense congestion of the mucous membrane of the stomach and bowel, and also of the kidneys. The urine is dark, turbid, albuminous, bloody, and as black as ink. There is a drop, but colchicum is readily distinguished from Lachesis by the prominence of irritation of the sphincter vesicae with the tenesmus of the bladder after urination. It is especially indicated in gouty patients who at the same time suffer from a nervous weakness which is combined with hypersensitivity. In this latter symptom seems to resemble Lachesis. If this latter symptom seems to resemble Lachesis, we may readily distinguish it by the general effects of colchicum, namely oversensitiveness to touch, except perhaps the tympanic abdomen, senses too acute, especially over-affected by strong odors. Gastric symptoms are prominent, mental labor fatigues, causing inability to fix the thought or to think connectedly, headache, the skin of the scalp feels tense, coated tongue, nausea, great weakness, yet easily irritated by external impressions. The peculiarity of colchicum is that if there are copious salivation and urinary secretion, the tubes are scanty and attended with tenesmus and vice versa. Urine free ayinదంటే మోషన్ తగ్గిస్తుంది, మోషన్ ఫ్రీ ayinదంటే urine తగ్గిస్తుంది. I need not dwell upon the fevers of Lachesis because I have mentioned them in speaking of the mental symptoms of the drug. I may, however, speak of the intermittent fever which recurs in springtime in spite of the use of quinine in the form. The chill comes on at 1 or 2 o'clock in the afternoon. During the chill and here is a symptom which is characteristic. The patient feels that he must have clothing piled on him, not so much to keep him warm as to keep him still. He wants to be held down firmly to relieve the shaking and the pains in the chest and head. The fever is characterized with burning pungency by the oppression of the chest and the heart, and by the associated drowsiness and loquacity. This has to be held down during chill is also characteristic of gelsinia. Carboracy, like Lachesis, has annual return of the paroxysm. loquacity during the hot stage, thirstletness during the fever, and oppressed breathing. The patient is very weak from protracted disease and the abuse of quinine, but the thirst is greatest during the chill, not before it, and the chill is often accompanied by cold breath, coldness of the knees, even when wrapped up in bed. Flashes of burning heat in the evening attacks without thirst, flatulency, one-sided chills, left side generally, collapse are more marked. Capsicum agrees in thirst before chill, desire for warmth, chill beginning in the back, irregular intermittent pulse. But with the red pepper, the chill commences in the back and spreads then. The thirst continues into the chill and drenching aggravates the alert. The patient is relieved by hot applications and by a hot water bottle applied to the back. Menial thirst is preferable when the disease manifests itself in the coldness of the tip of the nose, the earlobes, and the tips of fingers and toes. Feet to knees icy cold. Hands and feet icy cold. Rest of the body warm. And Lachesis is called for in such irregular cases with cold nose, etc. The livid skin and great weakness, and as shown by the filiform pulse, are sufficiently distinctive. Filiform pulse, oscillating. Reflector. Agreeing more accurately are the following remedies, all of which produce weak or steady pulse, coldness and blueness of the skin, and of course, great prostration, carbolate. Veratrum, but in this drug the chill is associated with the thirst and its internal runs downward, not upward. Skin blue, cold, inelastic, hands blue, face, mouth and tongue cold, breathing oppressed and labored, hot, weak, cold, clammy sweat, work on the forehead, heat has no palliative effect. Arsenic external heat relieves, mouth and tongue cold, face blue, single parts of the surface blue, anxious restlessness, despite great debility, cold, clammy sweat, suffocative arrest of breathing. Camphor, icy cold surface, but hot internally, so he throws off the clothing, face deathly pale, limbs blue, breath generally hot, spasms is conscious, voice altered, so far follow. The main point was answer. We are discussing on the dryness of skin. Hydrochloric acid, marble-like coldness of whole body. పాలరాత్రి చాలా మీద ఉంటే ఉంటుంది కొనగలం అనమాట. మార్బుల్-like coldness of the whole body. Pulse feeble or imperceptible, long-lasting pain, brings roll audibly down the esophagus, clutches at the heart as if in distress, spasms, especially muscles of the back and the jaw are stiff, deliberate, muscles relax, suddenly he falls with coldness and cold sweat on the forehead, slow pulse, horrible convulsions with extreme coldness, rheumatic pains in the knees, dizziness, Like the snake poison weakens the heart. The skin is very cold, copious sweat, but the heart symptoms are not relieved. Once the intermits every third, fifth or seventh beat, very slow pulse. It will be remembered that Lachesis has oppression of the chest with cold feet. As the latter become warmer, the oppression lessens. Second, cold surface, sunken, pale face and blue lips will not be covered, tingling in the limbs. Hold the hands with the fingers widely spread apart. Cold clammy sweat, speech feeble, stuttering. Arashnavata resembles Lachesis in the chin of the back. Objective coldness of the body, convulsions, delirium, but the chill is once at night and spreads from the feet to the spine and then to the neck. The lowering of the temperature is accompanied by slow arterial action, drowsiness, or by delirious and excited talk, fixed at the bedclothes, fears of being poisoned, hallucinations, frigidar twitchings, etc. Lachesis, like Lachesis, causes glistening eyes during the chill, icy coldness of the body, relieved by warmth, but only the farmer has brilliant eyes and circumscribed red cheeks in the fever and delirium.